this is being recorded because we've had lots of requests to watch the meeting that from people who are unable to attend. Okay, we are now recording. And it's all yours, Tiffany.
Perfect. Welcome, everybody. Thank you for hopping on.
We can't see you though, Tiffany.
Yeah, it keeps every time I press say start my video, it says the host has stopped it.
Oh, I don't know. I don't know why you can't speak. Let me go.
I don't see anybody's face, to be honest, so I don't know if it's the whole thing.
Huh. Okay. It's just embarrassing. It is. Let's see. Okay, I think you should all be able to start your videos now.
Oh,
there we are. Okay, you can start your videos now. Sorry, everyone.
No worries.
You learn something new every single time you do a Zoom meeting. I think by now I would have it down pat.
It changes much like COVID, so it's fine. It's fine. All right, welcome everybody. Appreciate you hopping on, and I will do my best to answer your questions in the best realms. I do want to just give a plug that I am beholden to what I know from the state, and the state's beholden to what they know from the feds. So we try our best to get the information out as quick as we can. And unfortunately, at times, especially in the realms of vaccinations, it is lacking or extremely slow, or I know an hour before. So shoot away with your questions. I've got a few that were emailed in, and I will start with those, and we'll go forward with questions after that. Just a quick thing I wanted to say is that we are very grateful for everybody and all their help that they have given to us and are willing to give to us during this time. It is quickly moving, much like COVID did 11, 12 months ago when we first shut down the buildings in March, and has been moving since. So we are very grateful for everybody to be able to help us and be open and willing to support us. And we are very, very thankful for that. Last week, we were able to open up clinics on what we call a closed pod clinic, which was for our first responders, and then any MRC volunteers that we were able to get in as well that have and will continue to help us do our vaccination clinics and things like that. So we were able to do 252 as of yesterday. And so that's great. We're very excited. Plan going forward is to do Tuesday, Thursday clinics for the next few weeks, and then those may get large. They'll currently be at the RRC at Rosemary Recreation, and then they will at some point in the next few weeks transition to Cath. Once we start vaccinating our second round, like for their second doses, those clinics will double in size, plus continuing to do our regular first dose clinics for other people who are approved in the phases. So they will get really big really quickly, and we will transition to Cath at that point. Couple other things to know. We're very excited. Got word just an hour ago that our ultra cold freezer will be delivered Monday by 5 p.m. So that increases our chances of getting the Pfizer vaccine, which thus also increases our chances of getting this out faster. So we're very excited about that, and hopefully we'll work with the state on that and get that out sooner. And then the more knowledge we know, again, we'll keep you posted on all of that. Okay, so starting with some of these questions that I received in email, or that Sandy received and we got, I'll start with one, and some of these have already kind of been answered by the state or by the state website. If you haven't looked, everything that I talk about as far as registering and looking at where sites are and things like that is all up on mass.gov. And you click the COVID-19 vaccination button and where can I get vaccinated? And they're all right there. But one of the questions was, can we address how the phases will fall? They know that's up to the state, but a lot of the seniors are having a hard time grasping this as there are so many rumors out there. And you're going to continue to hear rumors. You're going to continue to hear different towns or different groups that are vaccinating outside of the phases. And I do understand that that's hard for a lot of people, but we have to follow this appropriately, and the state keeps asking us to follow it appropriately as much as possible so that we can continue to receive the vaccinations and make it equitable for as many people as possible. So I can't step outside of the phases that have been approved and the groups that have been approved within reason. We're not going to waste any vaccine, and that has been our goal and will always be our goal. We will not waste a dose unless it's outside of our control. So if we have an extra dose around, we're continuing to vaccinate our MRC responders and then calling around to any first responders and things like that, or we'll go to the phases above and see if they need them. I can't change how the state has decided to make the phases fall on a local level. I can't change that either for Needham specific, because we are now going to be what I'm calling a rolling clinic for all of the state of Massachusetts starting on Tuesday. So anybody in the state who fits into those phases can come to our site. So we can't do anything outside of Needham specific, outside of the state requirements and regulations that they have currently going. I think the CDC and a lot of the other states have made the seniors 65 and plus. Massachusetts has not changed theirs yet. It's still 75 plus, and that starts phase 1, round 1, which originally probably wouldn't have started till mid-February, but now that they've opened up the entire phase 1 as of yesterday, that may start the beginning of February in the next couple of weeks. So I can't say for sure, but it may. Again, we're always just beholden to how much vaccine there actually is out there. So if the state runs out of vaccine, we're all kind of on pause until we get more delivered from the federal. So I'd like to guess about 2 weeks for phase 1 to open up, or phase 2 to open up. Registration process, how will they do that? So we will be up, we're not currently, I just checked it, but as of some point today is what I'm told, we will be up on the state website. If you go to mass.gov vaccine and go, where can I get vaccinated? You have to read through a whole bunch of stuff, but there is a map that you'll get to that says current clinics open, and we'll be one of those stars on the current clinic that is open. And that will just have a link there that'll link to our system. They sign up for a date and time. They will need to bring, depending on what phase they fall into, if it's an age-related phase, they'll need to bring an ID. If it's a work-related phase, they'll need to bring a work ID. If it's a health-related phase, we're still working that process out, but at the current moment, I would advise anybody to call their provider and have them write you a quick note that says this person falls into a high-risk group with 2+ comorbidities. Don't need to know what they are. We just need to know that you fall in that group, and just bring that with you to be safe. We may not actually require that once we get to that phase, but right now that's kind of what I'm thinking, but it could change. But once you go in there to sign up on the link that will be posted on the state website, it will tell you what you need to bring to the clinic. Because if somebody pops in and we're doing our 75 plus, and I have a young 20-year-old that shows up, I'm going to ask why, how, when, and potentially dismiss them if they don't fall into the phase for any good reason. So we'll work that out. And then the third question on this one was, how will access to town buildings be if people do get vaccinated? And that I don't know yet. I can tell you it is not appropriate nor allowed to require this vaccination at this point in time, because it is only federally, it's only under a federal emergency use authorization, which means it does not have the full FDA authorization. It only has the emergency use. So no one can require it at this moment in time, because it's not a full, what's the word I'm looking for? A full organized, it's not the word I want, but a full drug like any other vaccine would be. So we can't require it. I don't think we're going to make people bring cards. We're not going to do any of that kind of stuff at the current moment. But we're looking at data and data points of how many people we vaccinate versus how many we don't, and what our infection rate will be at the time, and different things to see how we can, or if we can slowly reopen things in a timely fashion, but a safe fashion at the same time. So it's all becoming intermixed now, and we'll know more. I just don't know all definite parameters of that just yet, but we'll continue to work that out as we go through. Up on the weekly updates, Cindy will start putting on how many vaccinations we do each week. So those will be there. And then if you haven't or don't know, we have hired an epidemiologist to help us with data and information aggregation. And she's awesome. Her name is Hannah Whitehead, and she is helping us work through an ArcGIS information system that we can then post on our needhamma.gov/coronavirus website that will also have the vaccinations we do and things like that, and keep posted on there. So that will be up probably in the next couple of weeks as well. Okay, so that was all those questions. Another question was, when the time comes for regular people, in quotes, to get the shot, will there be provisions like the flu shot process for town employees? And I'm not 100% sure what they mean by provisions, but our goal is to do this as equitably as possible. So we want to make sure those that are working in one area and other areas of the town, if they open up all at the same time, that they have the same access as everybody else. So Tim and I are kind of working through how that process will work. We're working with the different departments to say, hey, how many can you get? This is how many we can do. Let's split them up so that not all your employees, if they get sick from the vaccination, will get sick at the same time. There are a lot of moving parts, but they are happening. If you fall into a phase that's outside of your work phase and you can get it earlier, please do. I would just advise that you talk with your manager to know, hey, I'm going to get my vaccination, because there are a few people who have had reactions from it as far as fever and chills and things like that, and have had to remain out of work. So if you're not doing it with your work cohort, please just let your manager know, hey, I'm going to go get this, just giving you a heads up. The town is going to work on emergency paid sick leave with that. So if you're out due to vaccination, make sure you let your manager know too, because HR will work that through with them. Otherwise, closed pods or closed clinics just for town staff may come. Again, it's just a matter of how much we can get from the state and what they approve for us to do. So we'll keep you posted on all of that. And then the other question that we have is, will you be prepared to handle any adverse reactions to the vaccination? So yes, we have our EpiPens. All of our nurses have taken a training on the EpiPens recently. I gave them all an education on the vaccination, had them go through it, read it, do all the CDC had an education piece we had to do. And the state has one. So what was appropriate for all of them, I had them do. We keep EpiPens. We have about 3 doses of EpiPens here. And then of course we would immediately call 911 if somebody had an allergic reaction. Localized reactions, yes, we've got ice packs, we've got those kind of things that we can use for a localized reaction if somebody needs it. But if anybody is anxious about having a reaction, I actually urge them to talk to their healthcare provider before showing up at our clinic. We are not an ER, we don't have that capability. So if you think that you're going to have that kind of reaction, please talk with your healthcare provider and make an alternative way or place to go get that vaccine, because we won't be able to necessarily handle it. But we can work through the basics. And if someone's having an anaphylactic reaction, we've got the EpiPens, we've got the training. Fire is not that far away and they will be here in an instant. So yes. And then if people have allergies, it's a good time to note too, if you get the vaccine, everybody's required to wait 15 minutes no matter what. But if you have any allergic reaction that is anaphylactic related to anything in your past since you were born, you will be required to wait for 30 minutes to make sure that you are safe. So just put that into your timing of when you come get the vaccine, that is what you will have to do. And then again, review the ingredients. If you do have any kind of reaction to any injectable of any kind in the past, read the ingredients to this vaccine to make sure you're up to date and that is not something that you're allergic to. But as far as everything else, food allergies, things like that, they're not seeing it as much as they thought they were. Yesterday, the state of California reapproved the Moderna vaccines that they had put on hold because they thought there were an increase of allergic reactions, but it proves that there was not. So just know we feel safe, we feel confident, and the rate of an allergic reaction to this is and has been no different than any other vaccine that people receive. Okay, I think that's the last of my questions that were sent to me. So I am good to go with any questions anybody has. You just want to raise your hand or do the little hand thingy on your thing. And if you're not on the screen, Sandy will let you in.
I don't have a hand thing.
Deal?
I can't find my hand.
It's at the bottom, Barry. It should be
don't-
at the bottom of your screen. It should say raise hand or something.
Yeah, I know it usually is, but I can't. I don't
Okay, well,
see
why
it on
don't
my-
you just ask your question?
I'm gonna find that hand. No. So, and I missed the first 50 minutes. Are we gonna be required to get this vaccine?
No, it can't be something that we require at this current moment in time.
Okay.
A few years down the road, I don't know, but right now, no. Is that it?
That's it.
Oh, that was an easy question.
So I have a question. I'll just ask a question. So I heard that there's a mutation to the COVID-19. Is the vaccination that is out now, does that work for that?
So yes, as far as their understanding is yes, the new mutation that is out there. So there's been a lot of mutations, and let's make sure we go from mutation to variant, because they're two different things. So a variant is a new type of strain of this one. But the only difference right now that they're seeing between these two is that the spike protein on the new COVID is more sticky than the spike protein on the previous COVID. And so it's just able to grasp hold quicker. But that's the only difference that they're knowing. So the vaccine should work just as fine as should any precautions that we have. It just tends to make people more infectious, easier, and quicker. And that's it.
Thank you.
You're welcome.
Karis, you can unmute.
Yep.
Okay.
Barry, it's on the bottom. If you open up participants, it's on the very bottom of that tab if you're looking for it. Question about like who gets vaccinated, who doesn't get vaccinated, and what's public and what's not public. I think for myself in Public Works, I could see residents having questions about employees that might be coming to their property. I could hear employees having questions about who they are, assigned onto projects or onto shifts. But I also know that there's HIPAA protection, so I'm not sure like what is going to be public or what isn't going to be public.
So the only thing that's going to be public is the number of vaccinations we give. If somebody requests that somebody else brings proof of vaccination, that is not their right, because yes, it is a HIPAA protected. Now, at some point, if it falls into the vaccination, like an actual vaccination record, like we all have to do every 10 years, get the Tdap, all that kind of stuff, then potentially. But right now it's just like I said, HIPAA, and nobody else can ask that question. Did I answer all that? I think it did, right? Okay. Was that for Evelyn?
Hi, question. What if someone is not quite 75, but they have quite a few underlying medical conditions, COPD, heart conditions, etc.? Do you go through your healthcare provider, or
So
do
no-
you do it through the state's website?
So you can do either. Not all healthcare providers are going to be receiving the vaccine. So just know that your doctor may not get it for several months because some of them are not opting into the system, and you have to it's an extensive review process to be able to get approved by the state. So you can't go to any of the open clinics that are there by the state. I would just suggest that you get a doctor's note that's saying you're high risk and need to be in this vaccination phase. Just because I don't know, if you don't come to us, I think that's what we're going to require, but I don't know for sure what other places, or if the state will say we're not going to require or we should require it. So that would be my suggestion now, just to work with your doctor now on that, so you have it on hand, and then yeah, you can go to any place.
And would that be part of phase 2?
Yeah, so what they call 2 comorbidities is part of phase 2,
Right.
the
Okay.
first step of phase 2. Yeah,
Okay. Thank you.
you're welcome.
So Sadie unmuted me, so I'm assuming I'm supposed to go next. The two questions I have are regarding masks and the likelihood that we're going to be wearing those for much longer, regardless of vaccine. And then the second question I have is there a tried and true list for the state of what a comorbidity is and how they are rated by priority?
Yeah, so, okay, so masks, hit that one, and then if I forget, remind me of the second question. But the masks, yes, even with vaccination and even after your second dose of vaccination, it is still going to be required to wear a mask and recommended highly for the 6 feet social distancing, as we don't know if this vaccine will actually protect people from passing it to other people. So one key thing to note about this vaccination is that it is much like the flu vaccination. You can still be a carrier, but you may not get sick from it. And so we don't know yet if I'm going to be a carrier and I'm vaccinated already, I don't know if I can infect other people still at this moment in time. So that is what they're still learning. So yes, masks and social distancing will still be in place. Quarantine, isolation will still be in place. All of that for the next little bit. And with that, I wanted to say, to just spur off a little bit, that this vaccination will not affect a positive, negative COVID test. It will affect an antibody test because you are developing antibodies from this, but you can still test positive, you can still test negative, because they are two different realms of what we're looking for. And then to the comorbidities. So yes, if you go to mass.gov and you look at phase 2, there is a list. They say 2 comorbidities, it's highlighted. It'll shoot you to the CDC website that then has a list of what they consider as a comorbidity for high risk for this. I don't think there's a level of which one's more, which one's less. I think just if you have any of them, and there's 2 lists split by a paragraph, I think any of those qualify. So. Yeah.
Hi,
Sandy.
Tiffany.
Oh, hi, Ann.
Once you get vaccinated, do you get something in writing, a certificate, so that you could prove it to the airlines or to your family and friends or whomever?
Sure. Yes, they come with a vaccination card, much like they used to use. Oh, there you go. Tim's got his up there if you can see his. Like from what childhood vaccination record type thing. We'll give you one of those. And then if you sign up with us and get it through us, we send you, after our clinic is closed and the process has worked through, we'll send you an email that you can download your medical record from the clinic, which also shows that. So, so you'll have two different ways of doing that. And then also note that this system we're using automatically populates into the state, what they call IIS, which is Massachusetts Immunization Information System. And all healthcare providers are signed up that system. So your healthcare provider will know you received the vaccination as well. So they're all interconnected. But yeah, you'll get multiple ways to receive that proof of vaccination.
Okay, great. Thank you.
You're welcome.
Okay, Dee Brown is up next. I don't know who Dee Brown is. You're on mute if you're trying to speak. Okay, we will lower your hand and come back if you have another question.
I think Anne had one.
Ann?
When you get your first shot, are you automatically registered for the second shot, or do you have to go through the registration process all over again?
So we've learned a lot from our last week's clinic with the first responders. So when you get your first shot with us, so you have to wait 15 minutes. So we'll come around and help you sign up for your second shot. So you automatically leave with a date and a time for your next vaccine. That way you have it. But
Thank
yes, you will need your insurance card to do that again. So make sure and bring your insurance card with you to the clinic.
Okay. Karen?
Tiff, I'm curious whether you think we will get to a place where we might have to just get 1 dose of the vaccine.
I don't know. I'd like to say no, and I'm holding out hope. Pfizer has said that they are going to send, I can't remember the exact number, like 600 million more doses by July. So I don't think so. The state has already put in that if we order a group of doses, they reserved our group of second doses. So as far as we can continue to vaccinate, I think we will continue to have second doses in Massachusetts. I do know that the federals are pushing to just get everybody vaccinated with at least the first one, and then they'll figure out the second one. But if you've seen the CDC updates in the last day, 24 hours ago, they updated that they have data that this will, if you miss your second vaccination, you have up to 6 weeks to get the second one.
Yes,
But they don't have any data beyond 6 weeks yet on
Right.
whether or not it will do that. So, so I think in Massachusetts we'll be okay, but it will be interesting to see what happens with the federal piece as it flies
Right.
out. So,
right. Thanks.
Tiffany, is it impossible to think if you got your first dose from Moderna and there was, for heaven's sake, there was a shortage? Would you be able to get the second dose from another vaccine?
no, they're not interchangeable because of the specifics of how the mRNA vaccination is working. There are more up and coming groups that are coming, and a couple that my understanding only need one shot, but they're still in their very early phases of trial. But they could be a potential for if we start to wane with doses here in the fall or in the summertime. But yeah, they're not interchangeable because of the specifics of how the mRNA works in your body.
Oh, I just thought of another question.
Yeah.
How long is this vaccine good for? Is it kind of like similar to a flu shot that you have to get every year? How long do they expect that we need to take these? Have they determined any of that yet?
No.
Okay.
So they haven't determined any, but the last piece I've read is they're thinking about 2 years, and then maybe a booster after that, but they haven't said for sure what that's going to look like.
Thank you. Megan, you have a question?
Hi, I'm just asking a question for Diane since she couldn't get through. She wanted to know if you have an EpiPen and severe allergy, should you go to the hospital to get the shot rather than this clinic?
So it depends on what the severe allergy is. If it's a severe allergy to any injectable, yes. If it's a severe allergy to food, no. Comfortable giving that here.
She said that her allergy is just shellfish, so.
So yeah, I'd be comfortable with that. I don't think there is too much of a concern. The concern would be an anaphylactic reaction to any injectable you've received in the past.
Okay, thank you.
You're welcome.
Are there any other questions?
Yeah, I've been raising my hand in the
Oh,
picture.
I'm sorry, Lynn. I thought you were, I mean to raise your hand on the system. I apologize. I'm not scanning faces. Go
I
ahead.
don't have the option to raise it on.
Okay, go ahead.
Tiffany, you said that you will help people sign up for the second dose at the clinic. What about for those of us who already got the first dose and can't sign up?
And can't sign up. As you should have gotten an email if you've already got, if you came last week, you've already gotten an email or should have. If you haven't, then let me know and we'll get that to you.
I got the email, but I'm not able to sign up on the system because the system is messed up.
Oh, interesting. Well, I'll have to troubleshoot that with you. I'll check up with you offline.
Okay, thanks.
If anyone else has a question, raise your hand in front of the screen like this so I can see. I'll scan through here and. Does anyone see anybody scanning? No, I think we're good.
All right, perfect. We're here. Again, this is the same. It's a changing and evolving situation. And one day we hear one thing, the next day we hear something different. So we'll keep you updated as much as possible. If you have any questions, please let us know. And we will get back to you as soon as we can.
Tiffany, thank you for taking the time to help us all out. These were a lot of good questions, and I hope that we all have a lot more information. Although I have more questions now I have to think about.
Yeah, sure. And we can definitely do this again if people think it's helpful, and we can open it broader to COVID in general as well. So
great.
Awesome.
Thank you all
Thanks,
for taking the
everybody.
time.
Bye.
Let me just stop recording.